Hi, I'm Deborah Gordon, and I want to talk to you today about two fairly common problems that I think don't get enough attention from either the people that have them or from the doctors that they consult. And those two problems are hypoglycemia and sweets cravings. Okay, you know what I mean by sweets cravings. Everybody has them to some extent. But some people will tell you that, oh, I just don't have one sweet tooth. I have 28 or 32 sweet teeth, depending on how many they've lost along the way. Sweets cravings can seem pretty normal, but really they're an indication that you're relying too much on sweets in your own metabolism. The other problem is hypoglycemia, and officially hypoglycemia means low blood sugar, but the symptoms of hypoglycemia, and the first time you have hypoglycemia, it can be kind of alarming because they're disturbing symptoms. They don't feel very good. You have a change in temperature. You can either feel quite a bit warm, hot and sweaty, or cold and clammy. Your heart's racing. You feel anxious. And those aren't symptoms actually of your low blood sugar. They're symptoms of the adrenaline that your body has released to deal with the problem of low blood sugar. That adrenaline is released when your blood sugar either falls precipitously, so it could just fall from 120 to 70, and you might have symptoms of hypoglycemia, or it could actually get quite low, 40, 50, 60. I'm not talking here about type 1 diabetics who rely on insulin, and when they have too high a dose of insulin, they get symptoms of hypoglycemia. You know what you need to do if you're one of them. You do need to eat something right away, eat something sweet. But what I'm talking about are everybody else. People who have bouts of hypoglycemia. They might have it on Sunday morning after they eat pancakes. They might have it on the afternoon following a big lunch. And they say, oh yeah, I have hypoglycemia. And if you ask them, most of them also have sweets cravings. So both of these are really serious problems because they're indicators, as I said, that you're using too much glucose for fuel. You're too often relying on glucose for fuel. And so when your blood circulation runs out of a good glucose level, your body freaks out and doesn't know what to do with it. Or I should say, your body doesn't know what to do about it. Your body releases adrenaline. The adrenaline causes your blood sugar to rise, and after a little bit you'll feel better, but by then most people have eaten. If you ask most doctors what to do about the fact that you get hypoglycemic episodes, they'll tell you to have something handy on hand to eat should that strike. But I'm going to suggest to you that the more intelligent answer about what to do if you have either sweets cravings or severe hypoglycemic episodes is to wonder whether you're not getting into the territory of prediabetes. Prediabetes is when you have some of the symptoms of diabetes or some of the laboratory findings of diabetes, not really enough to say that you're a full-blown diabetic. And by and large, doctors, like the rest of us, are kind of loath to think of having diabetes because diabetes is a horrible chronic disease. When you have diabetes, you're at increased risk for a lot of complications. Diabetics have more high blood pressure, heart disease, stroke, cancer, other inflammatory diseases, kidney disease, problems with their eyes. Diabetes is serious business, so we don't make the diagnosis lightly. But we probably should make the diagnosis a little bit more lightly than we do and group together all those people who we'd say have prediabetes, type 2 diabetes, metabolic syndrome, put them all together because the treatment for those is very benign. It's choosing a more healthy lifestyle. The sooner you choose that healthy lifestyle, the more likely you are to be able to reverse, prevent, cure diabetes. There have been studies recently that show that even when people are in that category called prediabetes, they too have an increased risk of all those diseases that diabetics get, as well as the increased risk of death that accompanies the diagnosis of diabetes. Diabetics can expect to live about 5 or 6 years shorter than the rest of us, just by virtue of their diabetes and the diseases that come with it. So where does that leave us? What I'm going to suggest, if you're one of those people who has strong sweet cravings or hypoglycemia, that you be really brave and look at the article on the website about diabetes. I don't think you have diabetes yet if those are the only symptoms you have, But following that eating plan, which is pretty much how I eat most of the time and what I consider a really healthy diet, following that eating plan, I'd be really curious to know if your sweets cravings go away, if your tendency towards hypoglycemia goes away, and then if you're carrying any extra weight, does that extra weight go away? Because this is also a great weight loss diet. If you don't need to lose weight, then there's no limitation on the amount of foods that you can eat from those foods listed. But if you have weight to lose, be judicious with the fats that you add. They're the most important part that you eat. You cannot skip them, but you don't need to overdo them. You don't eat them as much as you want to. You leave a little room so that your body can switch from relying on glucose for fuel that's given us that hard time in the past, given us sweets cravings, given us hypoglycemic crashes, and can learn how to burn fat for fuel, relying on ketones. Ketones used as fuel are tremendously valuable for brain health and longevity. It's not really clear, it's the subject for another whole video, whether burning ketones for fuel enhances longevity because the ketones are good for us or because it lowers our level of insulin because we're not eating so much glucose. Which provides the real benefit, the higher ketones or the lower insulin? I'm not sure, but we'll talk about that some more. What I want to say to you today, though, if you've got sweets cravings, if you have hypoglycemic episodes, please take them seriously. They're not part of a body in good balance and good health. And the best shortcut I can give you is to follow the advice in the diabetes article, and then you may never need to really open a serious article about diabetes. I'm Deborah Gordon. I look forward to talking to you next time. Bye.